Happy Naturopathic Medicine Week. So what is the difference between an MD, DO, and naturopathic physician, otherwise known as an ND or NMD? Let's talk about it. Starting with similarities, each of these programs have to go through 4 years of undergraduate medical education to receive the necessary prerequisites to gain admission to each program. Once admitted, each of these medical schools are 4 years long. The first 2 years of these 4 years is generally considered the didactic years. So these are when we learn our basic sciences. These include physiology, anatomy, biochemistry, neuroanatomy, embryology, histology, and pharmacology. Some added didactic education for naturopathic physicians includes things such as botanical medicine, hydrotherapy, physical medicine, and lifestyle counseling. The average number of credits for a naturopathic medical program in these first 2 years are just under 200 credit hours, and the average number of credit hours for an MD or DO program in these first 2 years is just under 100 hours. A main difference between these programs is residency. So for an MD or DO program, residency is mandatory, and these generally last anywhere between 3 and 7 years. This is also when an MD or DO will specialize. So for a naturopathic physician, they generally have an optional residency, and these last anywhere between 1 and 3 years. Naturopathic physicians also don't really specialize. Naturopathic medicine is considered a kind of like a specialty in and of itself, and you are able to concentrate in an area such as oncology, family medicine, sports medicine, things like that, but it's not considered a specialty in an official way like an MD or DO would do. Usually when you go see a physician or you're talking about a physician, you're generally talking about an MD or medical doctor. Medical doctors follow an allopathic medical practice, also known as Western medicine or modern medicine. This type of medicine utilizes surgeries and pharmaceuticals to treat patients, and they generally follow a symptom approach for treatment. The next most common type of physician is a DO or osteopathic doctor. So these are very similar to an MD. They generally practice modern medicine, but also take on a more holistic approach. They also utilize osteopathic manipulative techniques, which is similar to a chiropractic practice, but also are able to specialize and utilize surgeries and pharmaceuticals just like a medical doctor. An NMD or naturopathic medical doctor generally follows alternative medicine, and this is based on 6 principles. The first principle is first do no harm. The second is the healing power of nature. The third is identify and treat the cause. The fourth is doctor as teacher. Fifth is treat the whole person, and sixth is prevention. So generally, naturopathic physicians follow a very holistic approach to their patients. They want to identify the root cause and then use natural and holistic remedies to treat the person and basically support the body in a very natural way. I personally chose naturopathic medicine as it is what aligns with my morals and values and how I believe God designed the human body to heal. I definitely see the importance of each type of program and each type of physician in the field of medicine. My mom and I have what we call our Humpty Dumpty clause, where if we're broken, such as having a fracture or need surgery for whatever reason, we would definitely utilize an MD or DO to fix us. Right now, the scope of practice for a naturopathic physician is generally pretty limited across the US, but I definitely see that changing for the future as it becomes a more well-known and growing field in healthcare.